So we are discussing about testosterone replacement therapy, and I'm going to talk about why there is a controversy around testosterone. So the controversy is not because of testosterone, but controversy is because of there is no clear consensus on how to measure testosterone level, whether free is most important or bound testosterone is more important, up to what level we should treat, up to what duration we should treat, and whether we should use topical testosterone or transdermal or intramuscular. That is a controversy around the testosterone usage. Also, there are different consensus which is interpreted in a different way by different bodies, and also there is some medico legal litigation because of which the clinicians are hesitate to use testosterone. So these all are things that we have to understand before reaching to any consensus, rather than we are treating testosterone deficiency in a other way. If there is some hypogonadotrophic hypogonadal symptom, or patient is having low testosterone, we are treating with lifestyle modification. We are giving them either PD5 inhibitor, or we are giving lifestyle modification, or we are giving mood elevator, but we are not replacing the testosterone per se. And also there is some fear around testosterone replacement therapy, whether they are perceived fear or whether they are real adverse outcome, that we have to decide. So let's understand the perceived as well as real safety concern around testosterone. The first and most important is there is a nominal decrease in HDL level. But when there is a reduce in HDL level, there is also rise in body composition. Also, there is a increased insulin sensitivity. So whether this fall in HDL level clinically translated into some adverse event or not, that is not very clear. Also, there was some history talking about hepatotoxicity, but that was because of the alkylated usage of the injectable therapy, which is not associated with testosterone itself. Also, there is some association with prostatic enlargement and also lower urinary tract symptom. But if we use judiciously testosterone therapy and monitor them, these side effects can be reduced. And also in some comorbid patients, specifically cardiac patient, there is a fluid retention. Because of that fluid retention, there may be complication in that patient. Also, let's understand cardiovascular risk, abuse, and public perception. The cardiovascular risk is real or not, which is not proven in many in any study. It is just an observational association that testosterone replacement leads to over cardiovascular risk. Also, there is some abuse by bodybuilders for the bodybuilding of testosterone, and that kind of use leads to many side effects which cannot be correlated with scientifically replacement of testosterone therapy. And also there is distinction between physiological replacement and supraphysiological misuse that we have to understand and communicate properly to the general population. There is also therapeutic uncertainty and need of diagnostic rigor. When to measure testosterone, whether it should be repeated or not, whether we should see the testosterone level in along with LH, FSH, or directly we have to measure that we all have to understand. Again, concern about oral testosterone replacement, whether intramuscular, subcutaneous, topical, or intrabuccal testosterone should be used, that is required to be cleared by the consensus. And a clear diagnostic and therapeutic pathways are essential to balance benefit, safety, as well as the misuse concern that is happening. Thank you.